Knock, knock. Hey, Abby.
Hi.
How are we doing today?
Good, how are you?
Good. So what's bringing you in today?
I'm just here just for a checkup.
Just for a general checkup today? All right, so it looks like to begin today, we're going to be doing an assessment of your abdomen and your peripheral vessels. How's
Okay.
that sound?
Sounds right?
Good. Have you been having any abdominal pain?
Mm-mm.
How about excessive diarrhea, constipation?
No.
And then how about like hands getting super cold, feet cold,
No.
or like increased like texture surfaces of your skin, like where you feel like maybe it's dry skin, but it's just not going away?
Mm-mm.
Okay, good. So we're gonna begin with your abdomen. So I'm gonna go ahead and have you lay back on the bed here.
Okay.
And then I'm gonna scoot up here. And I'm just gonna kind of have you bring your shorts down just a little bit so that we can see all four quadrants of your abdomen, and then bring your shirt up just a little bit. Perfect. Okay, so we're gonna begin with inspection. I'm inspecting your skin color currently. It is appropriate for your ethnicity. You have symmetrical abdominal expansion with respirations, and then your abdomen is also flat. I don't see any abnormal surface motion, and there are no abnormal venous return patterns, which that's all normal findings for someone.
Okay.
Next, what I'm going to have you do is I'm actually going to have you kind of raise your head and attempt to sit up. And when I do that, I'm looking for any masses, herniations, or abdominal muscle separations, which in this case I do not see any. Next, we're going to move on to the auscultation. So I'm going to be using my stethoscope here. I'm just going to be listening to your different quadrants, okay? Might be a little cold. Okay, so you do have bowel sounds active in all four quadrants. They are normoactive, which that is a good finding. Next, Abby, we're going to go ahead and, sorry about that, we're going to assess your arteries. We're going to look at the aorta, the renal arteries, the common iliac, your femorals, okay? And we're going to be using the bell of the stethoscope to listen for any bruits. I'm going to lift your shirt. I'm going to keep you covered though, okay? So we're listening to your aortic right now. And then we're going to move over to your left renal, your right renal, common iliac, left common iliac. I'm going to come underneath a little bit here. Left femoral. I'm going to lift right here. And your right femoral. Excellent. So there are no bruits noted. Next, we're going to do some percussion. Okay, so you're going to feel my hand on you, and you're going to feel me start tapping around. Okay. All right, so there is tympany throughout all four quadrants. I did not note any dullness over the liver, but when we were doing that, Abby, we were assessing for any splenic dullness or gastric air bubbles, which you do not appear to have any. Next, we're going to begin with some palpation. We're going to begin with some light palpation, so I'm going to just be, gently touching you. After that, we are going to be doing some deep palpation. If at any point, you're having any signs of pain, tenderness, please just let me know, okay? So we're going to start with light palpation here. Any pain?
Nope.
Okay, we're going to move up to your right upper quadrant. Any pain? Left. Any pain?
Nope.
And left lower. Any pain?
No.
All right, so next we're going to do deep palpation. Any pain?
No.
We're using circular motions here. Pain?
Nope.
Any pain?
No.
Finally, we're gonna go down here. Any pain?
No.
All right, next we're gonna go right over the umbilicus. We're just feeling the umbilical ring, just to see if there's any bulges or masses with palpation, and there are not. Next, we're gonna assess your liver. So what I'm gonna do is I'm gonna start from below here. I'm gonna work my way up feeling, and then I'm gonna have you take a deep breath when I say so, okay? You're gonna feel me come underneath your rib cage here, and deep breath. And exhale, good. Next, we're gonna also do something called the hook method. You're gonna feel me kind of dig my hands underneath your rib here. So I'm just gonna feel for your ribs. And you're gonna feel me hook my fingers underneath and take a deep breath and exhale. Good. So I'm unable to palpate your liver, which that is actually a good finding. We are looking just to make sure you don't have something called hepatomegaly, okay? Next, we're going to look at the spleen. So I'm gonna kind of place my hand under here. I'm gonna come right here, and at about a 45-degree angle, I'm gonna push, and I want you to take a deep breath and exhale. All right, so I do not feel any splenomegaly present. And then last but not least, I'm just gonna feel right over here at your gallbladder. Make sure I don't feel anything abnormal, which I do not. All right. And then during that assessment, I did not palpate any aortic pulsations or other masses. Next, Abby, I'm gonna have you go ahead and sit up. And I want you to kind of turn that way so that your back is facing the camera. I'm gonna lift your shirt here just till I see your bra line. You're gonna find your costovertebral angle. And you're gonna feel me do some percussion here, okay? Tell me if you have any pain or tenderness with this. Any pain?
No.
All right, other side. Any pain?
No.
Okay, good. Alrighty, so we can go ahead and have you lay back down now. And we're gonna go ahead and move on to the peripheral vascular exam. So we're gonna be just kind of looking over your body right now. I'm gonna look for any color changes, texture changes, changes in your nails of your fingers and your feet. You do have nail polish on, so it might be just a little bit difficult to assess, but to our best ability, we will. And then I'm also gonna look for any edema or varicosities of the legs and muscle atrophy. So I'm just gonna take a look at your hand here. Capillary refill is less than 3 seconds. Find a toe here that doesn't have as much nail polish on it. And capillary refill is less than 3 seconds. Good. So next we're gonna palpate your pulses. So I'm gonna start up here with your brachial. And I'm gonna feel the other side here. You go ahead and just let your arm down. And right now I'm assessing and palpating for your rate, rhythm, contour, and amplitude. And your skin is also warm, dry. The pulses are about +2. Do you have any tenderness while I'm palpating? Good. And your pulses, like I said, are +2 and rhythmic. And there is not a variable rate. So next I'm going to check your radials. Radial pulses are +2, regular in rhythm. Any tenderness? Good. Excellent. We're going to move down to the posterior tibial. I'm going to try to stay within the camera, but you're going to feel me touch down here. Pulses are +2. The rate is normal. You have a good rhythm. And then we're going to do your pedal pulses. Pedal pulses are +2. Normal rate. It's rhythmic. And as I said before, about +2. Next, I'm going to check for any edema in your feet. No edema noted. I'm going to come up here. Feel for edema. No edema noted. Any tenderness with this?
No.
And top of your legs. No edema noted. Okay. So next we're going to finish off here by looking up at your neck. I'm going to inspect your carotids here and your jugular veins. So I'm just going to move your hair out of the way for a moment. And just go ahead and breathe normally. Excellent. There are pulsations noted, which is a normal finding. And then I'm going to kind of have you turn your head that way. Good. And there's no jugular vein distension noted. And turn your head towards me. No jugular vein distension noted. And then I am going to auscultate your carotids for bruits. And feel me gently place the stethoscope here. All right, do me a favor now. Now hold your breath. And you can breathe. And hold your breath one more time. Okay. No bruise are noted. And then last, I'm going to palpate your carotid, so you're just going to feel me gently touch you. Just go ahead and leave your head straight. Carotid is palpable. It's +2. Rhythm is normal. And it's regular. You're going to feel me palpate the other side now. Using my 2 fingers here. Right carotid is palpable, its rate is regular, and it is rhythmic. All right, you can go ahead and set up now. All right, do you have any questions regarding today's
No.
exam?
Nope.
No? All right, well then if you have any questions, feel free to give me a call.
Okay.
All right, thank you.